So you kind of fell into this industry, just like my wife and I did as well, and
Mm-hmm.
becoming an expert and becoming an advocate and becoming an ambassador for this industry, breaking the walls, breaking the stigma. And then with that, you being a cannabis patient and a successful cancer patient. I hate the word cancer, but you've also it kind of moved you into becoming a cannabis coach. Can you talk about that?
Yes.
And what did you do? What did you do before you had this awful diagnosis 2 years ago, before you became a cannabis expert in the field?
Financial advisor.
Okay.
During the day. And I also trained as a chef. My husband's a chef. So we would do kind of just one-off caterings and events and that sort of thing. Yeah.
And so both of those go hand in hand. You know, everyone needs a financial advisor, and
and everyone needs to eat.
Absolutely. And everyone needs to eat. Yeah, that's called job security. Throw some cannabis, and your kids are off to college. You don't have to worry about anything. And so with that, moving into becoming a cannabis coach, did you start by working with other breast cancer patients that are going through this and giving them hope and saying, listen, this is what I did? Is that where you started and
Yep.
it expanded from there?
That's exactly it. So it just started as me helping people. I would see people come into online forums and just be so confused. And it started with just kind of sharing what I learned, helping them to cut through the confusion. And eventually I was helping enough people and seeing success and I was confident enough in myself that I realized that I could do this and really help people, and that I couldn't just do it for free all the time, unfortunately.
Yeah, there's a lot of patients that get it confused because there's so many different types of stories out there on the internet. I'll say, you know, the Google University, you know, and there's a lot of great information, a lot of misinformation out there. So that confused look is also scared. You know, when you get a diagnosis, a lot of patients are like, help, what do I do? And so certain like you, we help them avoid the tangled web in this industry, you know, and say, stop, breathe. I don't want to give you false hope, but this is what we can look forward to. You know, where to go, what questions to ask, what to avoid, how much, you know, you should take. Here are some great doctors to meet with too. And so where you've accomplished a lot in 2 years, not only being a wife, a mother of two, a cancer survivor, breast cancer survivor, now a medical cannabis coach, and then in a TED Talk speaker, which congratulations. I mean,
thank you.
That's a major compliment. I did watch your TED Talk. I thought you did a great job. And so what led you to, is the platform to share your story?
What led me to be on the TED Talk?
On the TED Talk, and you know, how did they find you? How did you find them? Did someone recommend you?
So like I said, I had been really healthy, or what I felt was really healthy. And so part of what I went down the road of cannabis when I was going through this. And the other thing I really clung on to was the idea of mind-body, the mind-body connection, mind-body medicine, because I thought to myself, well, I did the physical things. So what's all this other stuff that everyone's always talking about? So I was looking into mind-body medicine quite a bit. And at one point when I was reading a paper called Care and Feeding of the Endocannabinoid System is what it's called. It's a study. And
can you repeat that one? Did you say parents?
Care and Feeding of the Endocannabinoid System. It's a great review study.
It's 52 years of headsets and starting with the Walkman, which you probably don't even know, to the iPod.
Oh, I remember. I used to see it on TV. Yeah, in old TV shows. Yeah.
So I didn't mean to cut you off there on the title. But if you can repeat that one more time for me.
So simultaneously, because I was into the cannabis thing, I was especially into the endocannabinoid system, which I think is just amazing. And I was reading this review study called Care and Feeding of the Endocannabinoid System. And one of the sentences at the beginning of that study says that the endocannabinoid system represents a microcosm of psychoneuroimmunology, which is mind-body medicine. And I saw that and I kind of sat back for a second and I started connecting all the dots. And that's what led me to just this idea in the first place. And I started talking to people about it. And I do know some people who are on the TEDx selection committee, and they were like, well, that's kind of interesting. You should see if this is something that they'd be interested in having you do for our next event. And I applied, and that's it. The rest is history.
And and I was gonna say, you said the rest is history, but yeah, you will go down in history. I mean, that's online, and
Yeah.
your kids will say, "That's my mom." That's and so way to go. I mean, what accomplishment! I
Thank
think
you.
I have a couple of buddies that have spoken on the TEDx talk and the circuit, and they've been. I think I'm a big fan of what where that's come. That TEDx talk has come, and so can you talk about you as a work as a cannabis coach? I think it's so needed because it's unfortunate, even down here in the U.S. from California and Maine. I'm going to still say about 12% of doctors really know about dosing, and
Hmm.
formulations and protocols. I mean, could you still get the doctors that say, here, Elise, here's your recommendation. Call me in a year if you want a renewal. Well, what do I do? Just go down to the dispensary
Right.
or take sativa day, indica night. And I'm thinking, goodness gracious, do you know what type of breast cancer was, what stage it's in, what type of cancer, not only just breast cancer, other medications. And so you being a cannabis coach, can you talk about the role of online forums, groups, coaching for men and women and doctors, that have been diagnosed with this awful disease? I mean, again, cancer does not discriminate, just as I
Yeah.
mentioned with Corinne, with you growing up in the health and wellness industry, your mom, I mean, I grew up with vitamins back in the 70s, and
Yeah.
so that has been my lifestyle as well. And so can you talk about your current work as a cannabis coach and what you do, and give us a walk of a daily lifestyle and how people can find you as well?
Sure. So as a coach, so I do two different things. One, I just do a straight, somebody comes to me, they don't know what the dosing protocol is going to be, because exactly what you just said, they get their prescription, but then they get nothing else. Normally you
Yep.
get a prescription, you get a bottle of pills, and it says, take one pill 3 times a day.
Yeah.
You get a prescription for cannabis, and there are hundreds of options, and there's oil, and there's tinctures, and there's dry flower, and you don't know where to start. So that's where I was. That's what I do is I help people. I look at what their diagnosis is, what their hormone status is, what other medications they're taking, if there's any interactions, and then I kind of give them this sheet that says, okay, take it this many times a day. Here's a strain. Here are the terpenes that might be beneficial for you. So that's what it looks like. And then I also, that's kind of where I started. Where I've headed is into like a full coaching program. And that kind of goes beyond just the cannabis knowledge, and it kind of helps, it treats the whole person. So
Good.
we know that cancer is a really traumatic experience. And so it works with fear, work on mindset, nutrition, movement, because I have all of those in my tool belt. And that's where I'm seeing the most impact, because people can also come back to me every week and say, okay, well, I've been trying this with the cannabis and here's what's happening, and I need a little bit of troubleshooting. And so that's where I'm moving, is toward the coaching.
Which I think is so important, having that support system. Doesn't matter if it's with cannabis or not, but when someone gets a diagnosis of cancer, you want to be that support system, give them hope, continue the hope, but also let them know, just like you can live a successful, healthy life having diagnosis of cancer, and we're going to beat this thing. And that's, staying positive with that. And so one of my questions, and you answered them actually, is, you started off as a cancer specialist, a breast cancer specialist, and now you've taken talking about the whole body. And breast cancer affects not only women, but men. Have you worked with any men that have gone through this?
I haven't worked with any men.
Mm-hmm.
And I don't want to say it's by design.
Mm-hmm.
I think it's in my branding, to be honest. I say women with breast cancer.
Gotcha. Okay.
And that's, to be honest, if somebody came to me, if a man came to me and wanted a dosing protocol, I would be comfortable helping him. But from a coaching perspective, a lot of the work that I do involves kind of being in a group setting. And a lot of women do like to be with other women.
Yeah.
It comes to that. So I haven't taken anybody on any males on as clients.
As client. We have a lot of Canadians that are followers here at the Sacred Plant. And so hello to our friends north of the border. And can you share the legalities up there? Because I know, just like down in California and different states, we have different laws. And is that the same with the provinces up there in Canada? Because we have so many patients saying, help, I don't have access here. I have to get some, in Vancouver, I have to get it over on the East Coast in Ontario. Can you give us just a little, us Americans and the rest of our listeners, even Canadians that are watching us, what are the laws like up in Canada? And it's not, is it available throughout your country or in certain provinces? If you could share some of that before we go on to the other questions.
Sure. So it's legal everywhere. You
Okay.
can get it everywhere in Canada, but each province has its own governing rules.
Yep.
So Ontario, for example, we can buy it on the government store. There's a government website. If you're a medical patient, if you have a medical card, you can go directly to what's called the licensed producers, and those are accessible across Canada. So if I'm in Ontario and the licensed producers in British Columbia, I can still get the cannabis.
Oh, good. Okay.
But then Alberta, as an example, has a completely different set of rules in terms of where you can buy it from as a non-medical user. You can just go into a dispensary similar to probably what you have in California, and you can just buy whatever you want, but you don't have necessarily the quality that you would get from the licensed producers when you're a medical patient. You don't have as much access to CBD, for example.
A lot of Canadians that follow us say they don't have access to THCA.
Okay.
Is that not readily available in your stores?
As a tincture?
As a tincture, correct.
Okay. I mean, they can make their own with just the raw flower,
Yeah.
and it's possible. You know what? I don't think I have seen it very much with the licensed producers around here. So yeah. They're probably right.
Because a lot of Canadians say, wait, what's THCA? I've never heard of that. How do I get it? And I said, well, you can juice it, but in a lot of dispensaries, especially down here, now they have them in sublingual tincture bottles that you can just
that's great.
Getting your own, so you don't have to worry about growing or electric bills. I mean, growing cannabis is not as easy as I think raising children is easier than growing cannabis. I mean, you have to spend a lot of time. It's not just even with children. Put them in clothes, add in dirt, add water or food, and hey, mom, thank you. I've had a wonderful life. Now, I mean, it's a lot. So let's talk about because breast cancer. There's so many different types of breast cancer: estrogen positive, negative, triple positive. I mean, how many different stages are there, or types, I should say?
How many different types? So there's estrogen positive, estrogen progesterone. Usually they go hand in hand. That can also be accompanied with HER2 positive. Yep. So you can have estrogen positive cancer and HER2 or HER2 negative, or you can be triple negative, or you can be just estrogen positive and or HER2 positive and estrogen negative. I think I named them all. Yeah. But it's so there's a lot of variation.
It's a lot of variations. And so can you tell us what you learned about hormones and THC?
So I want to be careful with what I say about that because so there are preclinical studies that have shown that THC does not affect hormone-driven cancers.
Okay.
And very recently, in 2018, Dr. Cristina Sanchez, I don't know if you're familiar with her,
of course.
She came up with a paper or a study, her and her colleagues, and it showed that when they in preclinical, so like in vitro and in animal studies, that THC did not discriminate between whether it was hormone positive, hormone negative, HER2 positive. But I also know cannabis nurses who practice exclusively with women with estrogen positive cancer do progress on high doses of THC. That doesn't mean that they can't use THC, but they have found in their practice that many times, and not always, women on high dose THC will progress. I'm talking really high doses, not like 25 milligrams, but like Rickson protocol style doses.
And I like how you kind of pave the road. I have to be careful on it because I agree with you. We did an article on that before the 2018 study with Cristina Sanchez, and I'm a fan of hers, by the way. I think she's a great educator and doctor, and she shared some great things. But we did an article about hormones and THC, and it's gone all over the place, just like suppositories.
Right.
And I know a lot of doctors that no. And again, as you and I talked about, I don't want to give anybody false hope. If the pen cap or cardboard works, do your suppositories, do your copy. And we have patients that say, I just put topical on my breast and it worked. And, you know, and so, you know, if something works and you truly believe, and as I don't want to say placebo, but we did talk about placebo and hope. You know, I think that's a big part of healing the body. And
Absolutely.
so thank you for sharing that portion about hormones and THC. And
I'm
they,
not sure if I muddied the waters more, but hopefully I cleared it
no,
up a little bit.
but I think it just starts a conversation, and ask questions. I always share with patients, ask questions. It's not illegal to ask questions with your doctor, and you know, especially family members. You know, bringing the family. I think it brings patients closer together with their family. And don't worry. I mean, when you're going through something like this, everybody wants to support you as well. In most cases, they want to support you in what you're doing. And so, with that, can you talk about what you've learned about using cannabis and conventional medicines? I know we talked about that briefly earlier, going hand in hand with each other. Can you talk about why you did that?
Why I did that? So, I mean, like I said, I found that there was a really great synergy there. I have my naturopathic oncologist, who's also a friend of mine. She uses a metaphor or an analogy. I can never remember the difference between the two. But she uses this analogy, let's say for now, of a weed, cancer being a weed, and medical, standard medical treatments being sort of like the pesticide to get rid of the weed, right? But the naturopathic oncologist, the herbs and cannabis, I think would be in that same wheelhouse, can really help to make that pesticide more effective. And it also takes care of the soil underneath, because you don't want to just kill the weeds. You want to make sure the person is staying healthy.
Totally.
And that's kind of the way I see cannabis and conventional medicine working hand in hand.
I'm a big, our doctors are naturopaths. And so I'm a big fan of naturopaths. And our doctor is also a international integrative oncologist, but specializing, like you said, a naturopathic oncology, doing everything besides chemo radiation, you know, tying it into the mind body wellness, as we talked about. So that's been our lifestyle forever as well. Can you talk the importance of the mind body practice in combining medical cannabis into that as well, for your protocol?
Sure. So I found that cannabis helped my physical symptoms, but I also found it helped relieve anxiety, which is a really important part of mind-body medicine.
Yep.
It helped my meditation, small amounts of cannabis and meditation, which I never did before cancer, by the way. But it made a huge difference in my meditation practice. And just knowing that all of those, I know we didn't really talk a lot about the endocannabinoid system or my talk yet,
talk about
or
it.
if we will, but the mind-body connection is really it's really important when it comes to cannabis and when it comes to the endocannabinoid system, because all of those parts, those parts that we would consider the mind-body medicine, so like meditation and relaxation and what else, cognitive behavior therapy, your thoughts, your emotions, those all affect the endocannabinoid system, and cannabis can also help to affect all of those factors. So they really all go hand in hand. I don't know if that answered your question.
Yeah, you did. And so didn't want to shut you down and say, we're not talking about your talk, but also let's talk about the endocannabinoid system, which I'm happy that you brought that up a couple times. Did you teach your naturopath oncologist about the endocannabinoid system, as well as any other doctors that you've worked with going through this? And did they know about it? Because down here, they're not learning about it in medical school, you know, and slowly but surely, you know, nursing schools and medical schools are starting to briefly touch the subject about the endocannabinoid system, that which we all have, you know, all mammals have. You know, and so can you, did you educate your doctor, and have you educated your doctor and other doctors about medical cannabis and the endocannabinoid system?
I haven't. I'd like to say that I have. That's on my list of things to do. Usually when I go in to see my oncologist, I have my list of reports and studies that I want to go through with him, and I haven't really gone through cannabis at the endocannabinoid system yet. But that's definitely something that needs to be talked about. I have a few friends who are physicians, and I have talked to them about it, and they've expressed they'd like to learn more. They wish more people knew about it, because it's an amazing bodily system.
It is. And since you don't want to talk about your talk, I'm going to ask you, can you talk about your talk on TED Talk and what you share, the message that you put out for anyone going through this, if it's a patient or a loved one supporting their loved one?
So the talk is called The Surprising Connection Between Cannabis and Mind-Body Medicine.
Okay.
I'm pretty sure. And that's exactly what it is. So I talk about a little bit about my own journey. I talk about a little bit about mind-body medicine. So all those different pillars, I guess we'll call them, of mind-body medicine. And then about how my own journey led me to cannabis and the endocannabinoid system. Beautiful. I talk about the endocannabinoid system and all the things that affect it. And then I really bring it all together and say, well, all the things that affect the endocannabinoid system, all those things are the physical aspects that we're also used to paying attention to for our own physical health. So, diet and nutrition and movement, but it's also the non-physical or traditionally non-physical aspects. And that would be relaxation, stress reduction, and your thoughts and your beliefs. And all of those things together help to support the endocannabinoid system. And the endocannabinoid system, for anybody who doesn't know who's listening to this, is a bodily system that's responsible for maintaining homeostasis in your body and among all the other systems of the body. And so that's why it really matters. That's why it's important.
Thank you. Bringing the body back to balance.
Yeah.
I think it's so important, and it's amazing when you share that, even with doctors, and they said, I've never heard of this.
Yeah.
And you don't need a lot. You talked about microdosing at the beginning. I think patients can have success at 2 milligrams. More is not always better. And you talked about pharmaceuticals, and I always use this analogy is, your doctor says, take 1 every 8 hours, not 8 every 1 hour. And so more is not always better in anything, even with pharmaceutical, conventional medicine, but especially with cannabis, and see how your body reacts. My body is very sensitive to salt and butter and alcohol. And so I don't need a lot. Even with cannabis, I can have success with 2 milligrams. I take a 2 milligram little gummy before bed. It helps me, where I know patients that need to take 50 milligrams to go to sleep, and so it depends on the patient, on the body, and the individual, what they're going through, what's their diet like, what's their physical health like, did they get exercise? Let me ask you, are there any patient experiences that you want to share that will help any of our listeners? Because, getting a diagnosis of any type of thing, if it's life-threatening or not, you kind of put you back. And can you share any of your experiences, plus or positive or negative, that will help a patient?
I think
wanting to incorporate cannabis into their lifestyle.
So specific to cannabis, one thing I would say before I would talk about cannabis even is, I think people need to be kind of their own hero, their own advocate. They have to quarterback their own situation. So often people kind of give all their power over to the doctors, and doctors, obviously they know a lot, and I'm not knocking them at all. But I think that they need to be kind of on your team, but you're still the one that's leading the team. So I think people need to take an active role in knowing their options, knowing what their best treatment options are going to be, and being more engaged. I see a lot of people that just aren't. That would be my biggest, that's what I learned personally. I'm a lot different with my treatment than I was when I first started. I definitely take the reins on it more. And when it comes to cannabis, my big advice would be tell your doctor. You do need to tell your doctor. If they're not on board with it, get a new doctor, but you need to tell your doctor, because there are drug interactions sometimes that need to be taken into account. And that would be my advice in terms of cannabis.
And don't be afraid. And I thank you. I wasn't thinking about telling your doctor, but I love that, because do not be afraid. I have so many patients that we've worked with over the years that they say, I can't share this with my doctor, or I can't share this with, because they go to my church. I just recently had that. I can't talk about it because he goes to my church. I don't want anybody else to know about it. And it's just like, goodness gracious, what's more important, your health, or breaking the stigma that, you're trying something, you want to be here next year, and so what message about cannabis and cancer do you have for any women that are listening and any men that are listening?
To trust yourself, and that kind of goes hand in hand with what I was saying at first. To see somebody who knows what they're talking about first and foremost. To see a cannabis nurse, to see a doctor, to see somebody who can give you a starting path at least,
Yeah.
and then. Like you said earlier, some people need 2 milligrams to be effective. Some people need 50. From there, you got to trust yourself. You've got to learn to listen to your own body and see what works for you.
And listening to your own body and what works for you. And you did oils, correct, under the tongue?
Yes. Yeah.
And a lot of patients, again, and you also did topicals for breast cancer. A lot of patients think the only way to consume medical cannabis is via smoking. And there's a bunch of different ways to ingest it. As a topical, a dermal patch, ingesting as oils, as tinctures. Did you ever go down that route where you said, at first need to smoke it, and then realized that wasn't the best way to administer cannabis for your breast cancer?
I didn't, because of the way I was introduced in the first place. I do have a vaporizer and I do use it, and I did use it for more like acute sudden pain or nausea. I would use it for that because it takes a couple hours when you're taking it sublingually sometimes. But no, I was lucky. I was introduced to it as an oil in the beginning. So
good. I promised you an hour here, and we're right there, and so I appreciate you taking time out of your day. Do you have any closing words for our listeners? Let's share how they can get a hold of you, your website, any upcoming programs, events, but most importantly, the TED Talk. And I think everyone should watch it. It's pretty impressive, and I thought you did a great job, Elise. And you can find, just Google Elise Keller, Keller, at TED Talk, and you'll find her topic up there of discussion. And can you share your website, Elise?
Yeah, the easiest way to get me is at elisekeller.com, ELISEKELLER.com. And it's really just a landing pages with a bunch of links to find me all the other places that I am. And I haven't posted my TED Talk there, but after this, I'm going to go on and do that because I forgot.
You haven't posted that?
I haven't posted it yet.
Come on.
It's on my list.
That should be on the top of your list.
It should. You're right.
Not like your wife and a mom and everything else like that. So we got to get you out there. But Elise, I thank you so much for coming on, being brave to share your story. A lot of patients don't want to share their story because they don't want to, offend anybody in families or in their communities. So I thank you for being brave and coming on, and I thank you for sharing your success. And kind of, if it wasn't for your dad's father who grew cannabis up there in Canada, that was basically it, right?
Yeah, that was it. You never know.
Isn't that funny how life works sometimes? I mean, that's how Corinne and I have lived our life, not only with the mind body medicine, but also everything happens for a reason. I'm still trying to figure out what the reason is right now with Corinne's passing, but I continue on this journey to keep her name alive, to meet people like you, to share your story. And I just feel that your story can help one person. That's a total success.
Absolutely.
And, and so Elise Keller, I thank you so much. If you get a chance, please Google Elise Keller, watch her TED Talk. She did an incredible job. Just shows you that cancer and disease does not discriminate. And I wish you another 100 years on this earth, if you want to be on this earth for another 100 years, but I wish you much success. And I hope our paths cross face to face one day as well.
Me too. Thank you for having me on. I appreciate it.
Yeah, Elise, thank you. And keep doing what you're doing.
Okay.
Okay. And so thank you, Elise Keller. This is John Malanka with The Sacred Plant, and I really hope you enjoyed this interview and meeting Elise. Please check her out on her website as well as on TED Talk as well. So we'll see you soon. Have a blessed day. Bye-bye.